How can you better manage your arousal in order to delay the onset of release? Discover with Mr. X all of the methods to know how to last longer in bed and overcome early release. What is early release? It is considered to be characterized when intercourse lasts less than 1 minute. However, this is not the only criterion to take into account. A therapist can help you identify the causes of this mechanism and provide you with personalized solutions. The definition varies somewhat between countries and medical societies. However, there are 5 main criteria that are frequently used. Release occurring before or quickly after mating, less than 60 seconds. In most intercourses, at least 75%. For a significant period of time, at least 3 months. An inability to slow or control release. Psychological distress in the subject and his or her partner. With regard to these criteria, it can be seen that in order to be characterized, the disorder must be prolonged over time, more than 3 months, and represent a majority of the subject's intimacy, at least 3/4. It is important to distinguish between a real pathology and minor accidents. The latter are linked to episodic external factors. Similarly, it should be stressed that premature release at the beginning of love life or at the start of a relationship with a new partner is frequent. It is only problematic if it persists over time. How to last longer in bed. 5 techniques to delay release. Number 1. Take time to breathe. Slow down your breathing. We all know intuitively that taking a deep breath has the immediate effect of relaxing the body. Making a conscious effort to slow down your breathing calms your brain and slows the onset of pleasure. It is necessary to take a deep breath coming from the belly to have the same time of inspiration as the expiration, and especially not to block its breathing between the 2 movements. Moreover, if you want to know how to last longer in bed, you should know that it is possible to learn breathing from the lower body. It is mainly based on abdominal breathing and allows you to calm down during intercourse. You are then able to release the pressure if necessary and thus bring down the arousal. Number 2. Learn to feel your body according to your level of arousal. During exploratory self-stimulation sessions, pay attention to your level of arousal and your body's response. Focus on areas of muscle tension. Is it possible to reduce these tensions? What effect does this relaxation have on your arousal and pleasure? It is important to learn to identify your point of no return so that you can better manage your arousal. This is how you will know how to last longer in bed. Number 3. Learn the squeeze technique to block release. At the moment of release, it is possible to block the exit of the emission by pressing a finger on the specific point between private parts and the rectum. The muscles contract, but the emission is not expelled. It remains in the prostate. This means that there is no loss of hardness and intercourse can continue. This is also possible by squeezing the manhood's tip with the fingers. This is the squeeze method. These techniques are an alternative to premature release, but of course do not treat the cause. To understand the cause, if the problem persists over time, we recommend consulting a therapist who is a specialist in these matters. If you can't keep it up despite these techniques, it may be due to erectile dysfunction. If you want to be sure, fill in the questionnaire in the description and you will have the answer in less than 5 minutes. Number 4. Strengthen your perineum to last longer in bed. To help you release more slowly, it is worthwhile to work on your pelvic floor muscles. The exercise is very simple. It consists of interrupting yourself several times when you urinate. There are other exercises to further tone your perineum PC muscle. Ask about Kegel exercises for men. The muscles you use to stop urination are the pelvic floor muscles. They come into play during release. Muscling them will not give you control over your release, as it is an uncontrollable reflex. However, it will help you feel these muscles and to release them more easily. You can delay your release by relaxing these muscles. Number 5. Change your position during lovemaking. Get to know yourself. Some positions will stimulate your manhood more than others. Find out which positions stimulate you the least so you can use them to delay your release. Changing positions also allows you to take a short break from lovemaking and bring your excitement down a little. If you would like to be accompanied in the implementation of these techniques, consulting a therapist online can be beneficial in order to guide you step by step. Lasting longer in bed. What causes early release? The causes of premature release are not clearly established. However, we do know the various factors that contribute to it. If you want to know exactly what causes yours, consulting an online therapist can help you in this rewarding process. Anxiety and premature release. Psychological factors. There is a clear link between anxiety and premature release. Men who suffer from it are more likely to have an anxious disposition. Anxiety feeds premature release, which in turn feeds anxiety. In some cases, premature release is caused by psychological factors such as stress, anxiety, or depression. This is most often the case when premature release occurs in the course of love life, when it occurs only in certain situations or only with a partner. Hypersensitivity of the manhood's tip and early release. It seems that in some cases, premature release is the result of hypersensitivity of manhood's tip. This is a manhood sensitivity disorder. In men with manhood's tip hypersensitivity, neurological stimulation is stronger when the manhood's tip is stimulated. Release comes more quickly. Some studies have shown differences in neurotransmitters between men who come quickly and those who do not reach climax quickly. These studies suggest that there is a biological or even genetic basis for premature release. There are other hypotheses. The causes of premature release are still relatively unknown and are the result of various factors. Why is early release still taboo? Many men turn to miracle methods, which not only don't work, you can't change a reflex with a wave of a magic wand, but they also miss out on diagnosis. Even if premature release is not a disease but a disorder, it can cause personal and interpersonal suffering within the couple, as well as drop in desire, shame, or a drop in self-confidence. Any suffering therefore deserves a medical diagnosis and solutions. Today, intimacy is a real public health issue. Indeed, we know that our overall well-being is intimately linked to our intimacy well-being. Finally, if early release concerns a large number of men, it is in fact a normal psychological reflex. Play down the situation. Lack of communication, unrealistic expectations, most often it is a matter of lowering certain personal barriers. We all have difficulties, and love life is not immune to the ups and downs of life. Don't focus on your bed performance. Intercourse doesn't have to last for hours to be satisfying. Caressing and foreplay are also important factors of pleasure. The important thing is to share a pleasant moment with your partner. In conclusion, how to last longer in bed and control early release. As we have seen, there are multiple causes of early release: biological predispositions and psychological or emotional factors. The biological factors can be remedied by taking medication. In addition to these drug treatments, there is a wide range of psychological and behavioral techniques, as well as delaying condoms. Since release is a muscle reflex, no man can control it. However, it is possible to learn to manage arousal and thus delay the onset of release. In the mildest cases, relaxation and breathing exercises can be enough to delay release. In any case, if you suffer from this and wish to find solutions, ask a therapist for advice to guide you.